Hello, my name is Paul Miles. I'm a retired pediatrician. I'm a fourth generation Idahoan. My father used to was a cowboy for a few years, rodeoed in the Jackson Hole area in the 1920s. Jim Trounson and I are former quarterbacks for the Wendell Trojans. So I actually grew up in Wendell, which is the model for Medvale. So Jim's family had an influence on my becoming a physician. His grandmother recommended that I apply to Stanford, which I did. I went there as an undergraduate and then went to medical school at UCLA and trained in pediatrics, and then came back to rural Idaho and practiced for 24 years in a small town called Twin Falls, Idaho. I got interested in quality improvement, and a medical student asked me a question that changed my career. She asked me, "Well, Dr. Miles, how do you know what you do works?" And like most physicians, I was trained and to believe that I was practicing really great medicine. When I actually looked at data, I realized that one, I didn't have a lot of data on my outcomes, but I was probably doing a good job in some areas and not such a good job in others. And that question began to haunt me that I was betting the lives of kids on the care that I was recommending and delivering, and I didn't always know whether it worked or not. So at age 56, I actually made a transition and left clinical care and moved to Nashville, Tennessee, and became the chief quality officer at Vanderbilt University Medical Center. And that was a challenge, but it was interesting going from rural primary care practice to a major academic center. And what I found was a lot of the problems were the same. It was just a difference in scale. I spent 3 years there and then was recruited to the senior leadership team in the American Board of Pediatrics. I had been an examiner for the board and had been the chair of the board of directors for the Board of Pediatrics, but it was brought there as the senior vice president for quality and for maintenance and certification. And my whole focus was on how do you help physicians measure and improve quality of care? And that's where I spent the last 11 years. Um, and had a wonderful opportunity. It was kind of a dream job for me. Um, then I retired and moved back to Idaho. While I was with the board, I had the opportunity to travel and give talks in most of the states around the country, visit most of the children's hospitals, and do some work in Europe. I have some good friends in both the UK and in Sweden and in the Nordic countries. Um, but I moved back to Boise and retired. I like to fly fish and like being back in the mountains. And recently, though, have become involved with a local healthcare system called Full Circle Health, which is a teaching health center, which means we have a family medicine residency and a pediatric residency. We train about 80 new physicians. Um, and then also, we're a federally qualified health center. So we serve 35,000 underserved patients. And the whole goal is to try to deliver the best possible care to those 35,000 patients and train the best possible primary care physicians. And we've recently developed this vision in 10 years of developing an exemplary healthcare system, being the best we can at delivering care and training new physicians. So that for me has given, I'm the vice chair of the board of directors, and it's given me kind of a new lease on um, trying to make a difference in healthcare, which has been really rewarding working with Jim Trounson and some other really close friends here in Boise.